Hello, my name is Dr. Sunanda Kane and I'm a professor of medicine at Mayo Clinic in Rochester, Minnesota. And I'm going to spend a few minutes talking about a new study that's just been published in regards to Crohn's disease and potential factors for exacerbation. Now we know that there are certain variables that will lead to an increased risk for disease activity, and that would include certain kinds of infections, potentially certain kinds of medicines like non-steroidal anti-inflammatories, smoking, and stress. What we don't know is how much other things may play a role as well, and one of these other potential variables, which was studied in this recent article, is depression. And so we know that there's a higher prevalence of depression in our IBD patients. And so this group looked to study the relationship between depression and the level of depression and the risk for disease activity. So this study was done using patients who are enrolled in what's called the CCFA, or Crohn's and Colitis Foundation of America Partners study. So this is an online voluntary database of IBD patients that is housed at the University of North Carolina, and that the patients in this registry were asked about depressive symptoms and then exacerbation of their Crohn's disease and even the endpoint of hospitalization. And as it turns out, that patients who scored enough to be considered clinically depressed were at increased risk for developing an exacerbation of their disease. And even more interestingly, the higher the depression scores, the more likely it was that they were going to have an exacerbation of their Crohn's, and those patients even ended up in the hospital. So what does this tell us? That certainly the mind and the body and the spirit are all interlinked very strongly, and that we cannot, as clinicians, necessarily just ignore depressive symptoms, and patients shouldn't be ignoring them either, because they may lead to very clinically relevant outcomes, and that if you are feeling as a patient that you are depressed or are at risk for depression, that you mention that to somebody, because we do have very effective treatments for depression, and some of them are medical and some of them are non-medical, but certainly patients who have issues with their affect, meaning that when they're sad, when they're lonely, when they're depressed, it does have an effect directly on their Crohn's disease.